Hi, my name is Fernanda Garcia Perez. I'm going to talk about preserved renal allograft function and the PD-1 pathway inhibitor Nivolumab. Definition: immunotherapy is the use of drugs to boost a person's immune system so that it recognizes and kills cancer cells more effectively. Several types of immunotherapy can be used to treat kidney cancer.
Every year, nearly 90,000 patients undergo a kidney transplant worldwide. Following the first transplantations in the 50s, allograft survival improved tremendously, with the graft surviving longer and longer. However, there has been no improvement in the survival rate over the past 20 years. And today, 20% of patients lose their new kidney within 5 years of transplantation. These patients must be put back on dialysis once they return to the waiting list, hoping for a new transplant. So we need to extend the survival of transplanted kidneys. To achieve this, patient monitoring after transplantation should be improved with an individualized understanding of the graft evolution and a personalized treatment. At the Paris Transplant Group, we investigated this by learning from historical records of more than 7,000 patients. For each patient, we collected more than 50 parameters, including histopathological, clinical, and biological data. And among those, we identified 8 parameters in our model that are able to accurately predict the graft survival. We've computed these parameters into an algorithm named iBox. For each transplanted patient, we are now able to predict their probability of graft survival at 3, 5, and 7 years ahead. The iBox has been tested on an external cohort of 4,000 patients and in 3 additional randomized clinical trials. The iBox risk prediction score has been proven to be highly reliable for patients, male and female, from Europe and the US, from different ethnic and social backgrounds, from different allocation systems, covering distinct clinical scenarios, and with different treatment. The iBox is the most validated score available in transplantation. The team at the Paris Transplant Group developed the iBox to guide patient monitoring and made it adaptable to most clinical scenarios, aiming for longer graft survival. Also, for the next generation of clinical trials, the iBox can accelerate the development of novel anti-rejection treatments, help researchers design new studies, and also constitute a valid and early surrogate endpoint. This would accelerate the development of novel anti-rejection treatments. Get further information about iBox in the publication from Alexandre Lupi and his team.
Applications in medicine. Inhibition of human checkpoints with the use of antibodies targeting programmed cell death 1, PD-1, or monoclonal antibodies against cytotoxic T lymphocyte.
The role of the immune system is to protect the body from foreign invaders. Normally, the immune system responds to tumor cells as it does to any foreign invader, by destroying them. T cells play a central role in this immune response to cancer. T cells are primed and activated by dendritic cells within the lymph nodes. They can then infiltrate the tumor microenvironment, which is comprised of tumor cells and other tumor-infiltrating immune cells. Here, the activated T cells detect, bind to, and kill tumor cells. Programmed death ligand 1, or PDL1, is one of the inhibitory ligands that, under normal conditions, help maintain immune homeostasis. However, in many cancers, PDL1 can help tumor cells evade the immune system, particularly when it is expressed in abundance. This occurs when activated T cells release interferon gamma. leading to overexpression of PD-L1 on both tumor-infiltrating immune cells and tumor cells. PD-L1 interferes with the body's anti-cancer immune response by binding to its receptors, B7-1 and PD-1, on the surface of activated T cells, thereby deactivating the T cell's cytotoxic activity. T cells can also become deactivated when PD-L1 expressed on tumor-infiltrating immune cells binds to B7-1 or PD-1.
Pros and cons. Pros. There is a drug that targets PD-L1 and proteins related to PD-1 that is found in some tumor cells and human cells. It's called Nivolumab and functions with blocking PD-L1 and can help stimulate the human response against cancer cells. Cons. Side effects of PD-1 inhibitors can include tiredness, cold, nausea, itching, skin rash, loss of appetite, constipation, joint pain, and diarrhea.
So I'm presenting the Checkmate 025 clinical trial, which is a phase 3 clinical trial that randomized previously treated patients with metastatic renal cell carcinoma to either treatment with Nivolumab, an immune checkpoint therapy agent, or everolimus, which is a standard of care agent. We randomized over 800 patients, 410 in the Nivolumab arm, 411 in the everolimus arm, to treatment with a one-to-one randomization, so that patients got treatment with either Nivolumab or everolimus. And the patients were treated until disease progression or until toxicities that they could not tolerate the drug. So what we saw was that the Nivolumab treated patients had an overall survival benefit of 25 months for the median overall survival versus the everolimus treated patients who had an overall survival benefit of median overall survival of 19.6 months. This was statistically significant, meaning that the Nivolumab allowed patients to live longer and provided the survival benefit. Currently, most of the patients who are receiving treatment for metastatic renal cell carcinoma in the second-line setting are receiving agents to target the tumor cells, and these are sort of tyrosine kinase inhibitors or anti-angiogenic agents. And what we're trying to say is that an immune checkpoint therapy agent can also be beneficial and provide a survival benefit. Most of the other trials also looked at progression-free survival. This is the first time in a phase 3 clinical trial that we're looking at overall survival, and that is really the gold standard for saying whether or not patients are doing well with a therapy. And so what we're saying is we have the potential now for a new therapy that can give patients this survival benefit.
Usually ablated inhibitor. Nivolumab are drugs that attack PD-1 appertain in cells of the human system called T cells that normally help and prevent these cells from attacking other cells in the body. In the country, they are used and have given good results.
As a scientist, I specialize in cancer immunotherapy. My work, and that of my colleagues, is to figure out ways to stimulate the immune system to kill cancer. To understand this concept, let's talk a little more about our immune system and how it works. Taking a look inside our body, all of us are born with an immune system that acts like the security checkpoint at the airport. Our immune system is like a high-tech full-body scanner system that protects us from things that are harmful. In the immune system, T cells have receptors that scan cells to distinguish between normal cells and abnormal cells, like virus-infected cells. Once detected, abnormal cells are attacked and removed by T cells. T cells also identify these cells for future recognition. The same T cells also play an important role in protecting us from cancer. Cancer cells are normal cells that have mutated. The more mutations cancer cells have, the more easily they are detected. Until recently, we didn't understand why T cells were detecting these cancer cells, but not destroying them. But on a closer look, we've made some revealing discoveries. We've learned that one of the ways that cancer cells get past the security system is with the help of a molecule called PD-L1 that is found on the surface of cancer cells. PD-L1 is almost like a disguise that allows cancer cells to remain undetected. PD-L1 basically hacks the T cell scanning system by jamming the signal to parts of the T cell system called PD-1 and B7-1. Think of PD-1 as a sensor that's part of the T cell scanning system, and B7-1 is like an alarm that issues an alert when something is wrong. When PD-L1 hacks the system, it prevents it from doing what it's supposed to do. In other words, it may prevent T cells from destroying cancer cells. Scientists have been working on fixing this problem and have designed molecules to target the PD-L1, PD-1 pathway. You can think of cancer immunotherapy as kind of like a software update for your immune system. Early studies suggest that by targeting the PD-L1, PD-1 pathway, T cells may be able to detect and destroy cancer cells. Let me show you in more detail. T cells have receptors that allow them to recognize cancer. Cancer cells can prevent elimination by turning on PD-L1. PD-L1 deactivates T cells by binding to PD-1 and B7-1. Blocking PD-L1 from binding to PD-1 and B7-1 could prevent PD-L1 from communicating with them. When this happens, T cells may finally be able to respond and kill cancer cells. Clinical trials are currently underway to understand the effects of trying to block the PD-L1, PD-1 pathway in the body. We are committed to studying cancer immunotherapy so that we can continue to find new ways to harness the immune system to fight multiple types of cancer.
Conclusion: CG analysis according to PD-L1 expression does not provide conclusive data, probably due to the sample size of each subgroup. There were no effects observed on the predictive value of PD-L1 in the both groups of treatment. Nivolumab has a acceptable safety profile compared to the everolimus, not deaths attributed to Nivolumab during the follow-up of patients in the pivotal study.
So Nivolumab is now FDA approved for kidney cancer, but of course, long-term follow-up requires a lot of time. And so now we've had, in some cases, 4 to 5 years of follow-up on the patients on these trials. And what's really impressive to us is that about a third of patients are alive at 4 years, and then for the study for which we followed beyond that at 5 years. So it looks like the term durable response is actually one we can say now, knowing that we're looking at those long-term survivals. The other interesting thing is that those long-term benefits occurred in patients regardless of their initial response to therapy, so progressors, including those with stable disease and response. It occurred regardless of risk group, so even those poor risk who typically have the worst prognosis, some of those, the trajectory of their cancer can really be turned around, it seems, by nivolumab.
Thank you.